Hey everyone, welcome back to the channel. If you're new here, I'm Desmond, and today we're going to talk about something that's super important for our health: antibiotics. These little lifesavers are used to treat infections. But how do they actually work? Why do we sometimes need them? And why do we need to be careful about using them? Let's break it all down in a way that's easy to understand. So, what are antibiotics? In the simplest terms, antibiotics are medications that fight bacterial infections. They don't work on viral infections like the flu or a cold, just bacteria. Bacteria are tiny organisms that can cause a wide range of problems, from a sore throat to something more serious like pneumonia or a urinary tract infection, UTI. When you get sick and it's caused by bacteria, antibiotics are like special agents sent in to target and stop the bacteria from making you sick. But not all bacteria are bad. Our body actually needs a lot of bacteria to stay healthy, which is why we need to be careful about using antibiotics. All right, so how do antibiotics actually work? There are a few ways they can stop bacteria from hurting us. Here are the main ways antibiotics fight back. Disrupting cell walls. Some antibiotics, like penicillin, break down the bacteria's cell wall, causing it to explode. Imagine the bacteria as a balloon. If you pop it, it can't survive. Blocking protein production. Others stop bacteria from making the proteins they need to survive. Without protein, they can't grow, reproduce, or do anything harmful. Interfering with DNA replication. Some antibiotics mess with the bacteria's DNA, which stops it from multiplying. So in a nutshell, antibiotics either kill bacteria directly or stop them from growing and multiplying. Pretty powerful, right? There are a lot of different antibiotics out there, and they each work in their own way. Let's take a look at a few types you might have heard of. Penicillin, one of the first antibiotics discovered and used for treating a range of bacterial infections. Amoxicillin, a type of penicillin that's used for ear infections, throat infections, and more. Ciprofloxacin, a fluoroquinolone used for more serious infections like UTIs or pneumonia. Azithromycin, a macrolide antibiotic often prescribed for respiratory infections, including bronchitis and pneumonia. Vancomycin, a powerful antibiotic used for severe infections like MRSA, methicillin-resistant Staphylococcus aureus. Each of these antibiotics targets specific types of bacteria, so choosing the right antibiotic for the right infection is super important. Now, just like any medication, antibiotics come with side effects. Some common ones might include upset stomach or diarrhea, rashes or skin reactions, yeast infections because antibiotics can kill off good bacteria too. But here's the real issue with antibiotics: antibiotic resistance. You may have heard this term before, and it's a huge problem. Over time, if we use antibiotics too much or don't finish the full course of treatment, the bacteria can develop resistance. This means the bacteria change and become stronger, making the antibiotics less effective. That's why it's so important to follow the prescription instructions. Finish the whole bottle, even if you start feeling better. Let's make this interactive. Have you ever been prescribed antibiotics? What was it for? And did you finish the full course? Drop your answers in the comments below. I'd love to hear your experiences. So, when do we actually need antibiotics? They're used for bacterial infections like strep throat, caused by Streptococcus bacteria; UTIs, caused by bacteria in the urinary tract; pneumonia, a serious infection of the lungs caused by bacteria; skin infections, bacterial infections like cellulitis. But remember, they don't work for viral infections, so they won't help with colds, the flu, or COVID-19. Overusing antibiotics can be dangerous. When they're overused, they can cause side effects, increase resistance, and sometimes lead to more harm than good. That's why doctors carefully consider whether you need them, and they're trying to use them only when necessary. So here's the recap of today's video. Antibiotics are used to treat bacterial infections, not viruses. They work by stopping bacteria from growing, reproducing, or killing them altogether. There are different types of antibiotics, each targeting specific bacteria. Side effects can happen, so it's important to be aware of them. Don't overuse antibiotics and always finish the full course to prevent resistance. Thanks for watching, everyone. I hope you now have a better understanding of antibiotics and their role in medicine. If you found this video helpful, don't forget to like, subscribe, and hit that bell so you never miss out on a new video. And as always, feel free to ask questions or share your thoughts in the comments below. Stay healthy, and I'll see you in the next one.